Working as a medical scribe is a popular option for pre-meds to both gain clinical experience and to boost their med school applications. I worked as a scribe in the emergency department for about a year before I transitioned into a CNA role, and while I did gain some valuable experience, just as with any other job, it does have its pros and cons. So for those of you who are considering working as a scribe, I want to lay out some of the pros and cons to help make that decision, and be sure to stick around until the end of the video for my overall recommendation. Let's dive in. Pro number one is that scribing essentially doubles as physician shadowing. While I would still try to shadow other physicians in a variety of specialties, this will supplement those other experiences. And while COVID did shut down many shadowing opportunities, I personally was still able to shadow several physicians in multiple specialties. However, if that were not the case, I still would have felt reasonably comfortable with my shadowing experience for my time as a scribe. Pro number two is that it provides a look into the thought process of a physician. So since you're following the doctor around for the entire shift, you get to see the entire process, from the initial patient evaluation and orders placed to the subsequent medical decision-making process leading up to either admission or discharge. And after a while, on some level, you start to develop some pattern recognition. For example, if you have an elderly female patient with acute onset confusion, based on similar cases that you've seen in the past, you may arrive at the conclusion that she may potentially have a urinary tract infection or UTI. Then you can search into her medical history to see if she has a history of UTIs. Let's assume that while checking the history, we did find evidence of a history of UTIs. We as the scribe can then venture a guess that the physician will likely place an order for a urinalysis. If and when that comes back positive for a UTI, it is then likely that that patient will be placed on antibiotics. That's just one example, but these are the things that you start to pick up on over time. Pro number three is that it teaches you medical terminology. So the training phase of scribing, before you even set foot in the clinic or hospital, requires you, for the most part, to learn all of the medical terminology that you will be using. Medical terminology is basically its own language, so having at least an introductory comprehension of this is very useful. Pro number four is that scribing does provide exposure to a clinical setting, which is invaluable in helping you decide if a career in medicine is right for you. I did also talk about this in my CNA pros and cons video, which I'll link in the description below, so I won't belabor this point too much here. Pro number five is exposure to charting. So as the scribe, you're accompanying the physician in all of the patient evaluations and subsequent workups, essentially documenting every component of the electronic medical record. This includes the history of present illness, or HPI, the review of systems, or ROS, and the physical exam, or PE. Not to be confused with pulmonary embolism. We do love our acronyms in medicine. And you do also pull in lab and imaging results. Additionally, in the medical decision-making section of the chart, the physician will dictate their decision-making process for each patient, and there's considerable learning to be had by reading through each one of these. The last thing I'll say on charting is that as a future physician, you'll be doing a ton of charting yourself, so getting familiar with this process early on is probably a good idea. Bonus pro number six is that it allows you to refine your listening skills. So when you're getting the history of present illness and essentially you're interviewing the patient, they will typically give you a long story, which is helpful, but not every detail is going to be medically essential or relevant, and it's your job as the medical professional to essentially identify the significant components of that and distinguish the signal from the noise. If you have prior scribing experience and think that I missed something that should be on this list, go ahead and let me know in the comments. Moving on to the cons. Con number one is that scribing is relatively passive, and more or less, you're just a fly on the wall. Your job is to listen and type. You may need to ask questions and clarify some things on occasion, but for the most part, you're kind of just in the background. Piggybacking off of that first point is con number two, and this is probably my biggest gripe with scribing, is that there's very little to no direct patient interaction. So because essentially you're in the background listening and typing, which granted is your job, you don't really get that direct patient interaction, and furthermore, you don't really get to work directly with the team of nurses and CNAs in actually caring for that patient. It's almost like there's an invisible barrier between you and the patient, and this is something that I didn't like about scribing. Con number three is that scribing is a low status position and you're very low on the totem pole. So the point in your medical journey where you are likely to be scribing, you are relatively uneducated and unskilled, and working in a high stress environment where education and skill are especially coveted alongside some of the most intelligent human beings you'll ever meet, being the unskilled and uneducated worker is an uphill battle. Although in my opinion, you can greatly influence this by your work ethic, your desire to learn, and just in general by the way that you carry yourself as a professional. Con number four is that scribing is hard work for very little pay. So to put this in context, when I left my full-time job in business, I was making roughly $80K a year, and I left that to make $8 an hour as a scribe starting out. And after my 90-day probationary period, it increased to $10 an hour. That hurt. In the end, scribing is all about the experience and not the money, but this is just one of the major downsides to be aware of. Again, if you have prior experience as a scribe and you think that I missed something that needs to be on this list, go ahead and throw it in the comments below. So would I recommend scribing? I would, and that's because it gives you a unique perspective into the thought process of a physician while also exposing you to medical terminology and the charting process. Additionally, the development of your listening skills, along with your ability to discern the signal from the noise, on top of all of these other benefits, makes scribing well worth it despite the downsides. If you have any questions related to this topic, ask away in the comments. I'm happy to help however I can. And if you haven't already, go ahead and watch my video on the pros and cons of being a CNA, which is another great option for pre-med clinical experience, and be sure to subscribe to the channel so you don't miss any future videos.